Welcome to Office Hours with Dr. Peace. I'm Dr. Peace, and I'm glad you decided to join us today. My guest is Caitlyn Galloway. She's a former student from just this last semester. She works in government, has a lot of information about policy, but she also is very well informed about histrionic personality disorder, which, if you're in this field, you know what we know is that what a complicated patient to be in. So I want to welcome you to the show and thank you for coming, Caitlyn. So,
Yeah.
how would you like to start?
Yeah, thanks for having me. If you want me to just dive into the histrionic personality disorder of it all, I'm
That's
happy to
great
do
with me.
that.
Sure.
Okay, so I got diagnosed with histrionic personality disorder officially last summer. In fall of 2024, I had a therapist diagnose me with it in a way that I found problematic. It was like our second appointment, and she did it in the last 10 minutes, which, in my opinion, is probably the worst way you could probably ever do that. I've been going to therapy since I was around 7, 8. I had gotten diagnosed with depression, anxiety, ADHD, the normal few.
Pick a diagnosis for me.
Yes. And I still think all those are accurate, but I knew there was something else. And as I had gone into college, I had been like, guys, there's something else here. Like, we're missing something. I don't know what it is, but it's there. Unfortunately, my dad passed away when I was 14. I don't blame any therapists for this, but I think the first thing when somebody comes to you with maybe like attention issues and they also have a dead father, it's like, well, there we go. That's the answer. That's the answer a lot of the times, for sure. But I knew it was not the answer for me. Like, I was like, this isn't it. Like, there's something else going on. I had a therapist tell me I had it, had a little bit of a freak out. It's a hard diagnosis to get. It's not really well understood. And that's why I wanted to talk to you about it, because when you Google it, it's like nothing. It's like the DSM-5 definition of it, and then a bunch of Reddit threads of people being like, my girlfriend has histrionic personality disorder and I can't handle it. I need to break up with her and she's so off. And I'm like, okay.
Had you
um,
heard anything about it before you heard those words from your therapist?
no, she was like, have you ever heard of histrionic personality disorder? And I was like, no. The only personality disorder I knew about was borderline personality disorder, but I didn't know what it was. So she had listed all the, like, the way, I guess for people who maybe don't know, the way that personality disorders are kind of determined is there's a list of like, I think for histrionic personality disorder, it's maybe like 9 behaviors. And if you have like 7 of them, then they start looking into if you maybe have the personality disorder. And she was listening to them, and I was like, wow, you just read me like a book. Also, if you Google it, it'll be like there's no cure, which I don't know if I like the word cure, but like you'll be like this forever and your life will be ruined. And I was like, oh, like I really, for about a month after, leaned into it. I was like, yep, this is who I am and it's not going to change. So let's do this. Eventually got a new therapist. And the thing also is that a lot of therapists aren't really trained to diagnose a personality disorder because of the complexity. And so mine was like, I can't diagnose you. Like, I don't feel comfortable doing that. So she sent me to a neuropsych evaluation, and he was the one to like consider my official diagnosis.
How wonderful that you had a therapist that, we're always, our code of ethics says don't practice in a field that you aren't good at, but we do it all the time. I've seen it
Mhm.
happen in so many rural mental health centers. A young person like yourself comes in, she's the child adolescent therapist. Why? Because she's young. So we do that. And so thankful for your therapist who said, we need to
Mhm.
push this on a little bit. It'd be like going to your MD, your primary care doc, to get a diagnosis, and they see you have a heart problem, but they don't send you to a cardiologist. It really is the same thing. So this person that you went to once you got that, because I am anti-diagnosis kind of thing. I can see
Mhm.
the value in it, in that it helps us understand what's going on, but too many times you said it, you just identify with it. Oh, great.
Oh yeah, like I was like, okay, time to really be histrionic then. Let's do this. And Definitely not a way to go about it that I would recommend. Luckily, I was in an intensive outpatient program at the time that I got like what I considered to be my official diagnosis. They weren't treating me for that. They were treating me for depression, which I could talk about my intensive outpatient program all day. I love it. It's the reason I decided to get my master's in social work. It like completely saved my life. But they prepared me really well for getting those results. And we talked a lot about like what are you hoping for? What should we expect? Like what should we prepare for? And a lot of the things that people told me were because a lot of the people who were there also had gotten neuropsych evaluations before, and they're like, just be aware you might get a diagnosis you're not prepared for. But I have something and I just want to know for treatment purposes. Because
Yes.
I don't think a diagnosis is like the end all be all, but it had gotten to a point where therapists had tried to treat the symptoms and it wasn't working. I feel like you might appreciate this. When he diagnosed me, he showed me the list of everything. It's like a 16-page like thing, which as someone with histrionic personality disorder, I loved 16 pages about myself. It was fantastic. When I was going through the list of diagnoses, it had said that I had a histrionic personality. And I was like, okay, does that mean I have histrionic personality disorder? Or are you just saying that like my personality leans histrionic? And he was like, I mean, if you really want to like do that, yes, you have histrionic personality disorder. And he's like, the code that I put in there next to it is hit the code for histrionic personality disorder. And he was like, but I don't like to define it as a disorder. And he's like, you can define it however you feel. He's like, it kind of insinuates that there's something wrong with your personality. And he's like, there's nothing wrong with it. It just happens to be histrionic. And I do identify with the disordered part of it, but I do appreciate that as somebody who is diagnosing people with this, that that's how he does it. I thought that that was really, really nice.
Yes, because it's not who you are, it's what you have. That's the reason we stopped saying things like identifying people as drug addicts or
Yeah.
alcoholics. They're a person with a
Yes.
substance use disorder. The words we say really matter. You're Caitlyn.
Yes.
That's who you are. And you
Yeah.
happen to carry around some of these other things.
I see it more in like the medical sense. Like I remember I was talking to some people at my intensive outpatient program, and I think a big struggle with a lot of the people was feeling so humiliated by being there. And a lot of times also the circumstances that led us there. I was there because I had gone through two really bad breakups in a row, and I have histrionic personality disorder. So I don't handle that well. Like that is what led me there. Meanwhile, there's people there who were leaving abusive relationships or who were dealing with like the death of a child and stuff like that. And I really, really struggled for a long time to be like, I deserve to be here. Because again, I'm in this trauma group. Like I was in the trauma cohort of it, and I'm like, my trauma is that I got dumped. Are you kidding me? Like, and I started thinking about it more in a way that I was like, okay, if two people come into the hospital with a broken leg and one person broke his leg because he was like in war, and another person broke their leg because they slipped on a banana peel and fell down the stairs. They both deserve the same treatment, 100% same respect. And that really stuck in my head. So I do think that the way all of this is talked about really matters.
It does.
Um, Especially
How
when you're in.
would you, if you were trying to explain to someone what that diagnosis, what are the symptoms, just for people listening that might not know what we're talking about?
Yeah, so I have two ways that I like to explain it. Like I can explain what the DSM-5 says, and
Okay.
then I have my own explanation.
Okay.
Which also, side note, the DSM-5, I guess, is considering taking it out, which is a whole other thing, or in for the DSM-6. But whatever. I pulled up the symptoms before this. So
And you know what, Caitlin? That's why I don't like the DSM. Is because there have now been five, and then TR, and then they go into another. And it's because we evolve and we understand more. The brain is like
mhm.
such an unknown. We just aren't good at diagnosing things about mental stuff. And so that's why I just disagree so strongly with saying these particular symptoms mean this, and then that means this
Yeah.
treatment will work for you. We both know this treatment that works for me might not work for you at all. And we have to be
I mean, I'm in
knowledgeable about that.
I'm doing ketamine therapy for treatment resistant depression. So like I've it's just that like yeah, I think it's not as cut and dry as people like to make it seem.
We want everything to fit in a neat little box, and human behavior does not. It's so complex.
So, histrionic personality disorder, the core symptoms and signs are attention seeking, provocative behavior, shallow emotions, physical focus, like on your appearance, vague speech, theatricality, suggestibility, and overestimating intimacy. So, in general, it's basically being like dramatic and having attention seeking behavior. I don't consider it dramatic because in my head the emotions are that big, but that's certainly how it comes off. And then the way I describe it to people, because I think it's hard, because I'm sure there'll be people listening to this being like, wait a minute, that kind of sounds like me. And it totally could be you. I can't diagnose people. I don't know. But I describe it as it's not just those symptoms, it's because you can be histrionic, just like you can be kind and smart and funny and histrionic. You can have these character traits without having the personality disorder. And I think that's a really important distinction. And so the way that I describe the difference between just having that character trait and having it be to the level of a disorder, I kind of describe I have this like veil over my head. And every thought that I have and every behavior that comes out of my head, my emotions, anything that's coming out of there goes through this veil of histrionic. And so it gets influenced by that. And as I have done more therapy and done more work on myself, the veil gets thinner, the holes get bigger. So things will go through without passing the histrionic part. Sometimes they will, sometimes they won't. And I found that to be the best way to describe it to friends and stuff who are having trouble understanding it.
Is it associated with emotional dysregulation? When I hear you describe things
Yeah.
come through as histrionic, I think emotional
And
dysregulation, where in, having a trauma of your dad dying, I don't know, that sort of,
yeah.
is it associated with that?
Yeah, so there's definitely a lot of emotional dysregulation involved, which I have realized by learning how to regulate my emotions better. As I've learned how to regulate my emotions better, now my symptoms are less severe. It's like depression and emotional regulation are the two things that I feel like are the big factors. So, like I said, I've been doing ketamine therapy, which the drug name is Spravato. I've been doing that. It's like a nasal spray since January. And that's for, like I said, treatment resistant depression. So like I've been on everything and none of it does anything to me. So I'm now on this. And as my depression has gotten better, as those symptoms have started to slowly become less intense, my histrionic symptoms have also gotten less intense. So the depression and the emotional regulation are two huge factors for me.
SSRIs is probably what you're talking about, what you were treated with before. What's the difference between a ketamine regimen and SSRIs?
Oh God, everything.
Oh,
Like
really?
where do I start? In a practical sense, so hard to get on. I don't even understand the full process it took to be able to get that approved. I'm pretty sure because it's a newer drug, um, like a decade old on the market, I want to say, which in drug time is like 30 seconds.
I think of it as a drug of abuse, like Elon Musk is what I think of.
Yeah, and you know what? When I told my friends, because I do have an addictive personality, I don't have any substance abuse issues, but I do have an addictive personality. And I remember when I told my friends I was going to be on it, they were like, "Oh," because Matthew Perry recently died because of
Yes.
ketamine and stuff like that. But it takes forever to get approved. I'm pretty sure, don't quote me on this. I'm pretty sure my psychiatrist had to get Johnson and Johnson to agree that I was a good candidate for it. And then once they were agreed on that, then he had to get my insurance to approve it. For that, I had to show a history of mental health treatment that didn't work. So all of the SSRIs I was on, the doses, the date when I started, when I stopped, like proof of how long I've been doing therapy, proof I went to the IOP, like that I've worked, that I've done everything, and that it's not working. I think the approval took like 3 or 4 months. And then I started it. You start on like the lowest dose and it's a nasal spray. You go in, you do the nasal spray, and then you have to sit there for 2 hours. And so you just sit there, to be honest, high, like
Oh,
very high.
really?
So you sit there for 2 hours and then you can go home, but you can't drive for that day. Like I rent in the city, so I take the train. But even the first time I went, he was like, do not take the train. Please take an Uber. And then if you want to afterwards, if you feel like it's okay, you can take the train. But, we don't know how it's going to feel.
So you
Yeah.
still have to stay there.
Oh, yeah. I stay there for 2 hours every time.
So anytime, and how often do you receive a treatment?
So you start at twice a week, and then you go to once a week, and then you go to every other week. And we had done that whole progression, and I had no improvement in symptoms. So then we went back to the once a week starting in like April, and then in May was when I started feeling better. So now I still go once a week. I'll probably go down to every other week soon, but it's definitely a big commitment. I work full time, I'm in school part time. I've had so many periods of my life where I haven't given my mental health what it needs, and I'm like, I have to. Like, I have to do it. And it's great. It's very safe. When you go there, they check your blood pressure and your blood oxygen level, and then they check it halfway through, and then they check it before you leave. I love the place I go. They're so nice. It's been a really effective treatment for me. There's been such a reduction in symptoms. And like I said, when my depression isn't as severe, neither is my histrionic personality disorder, it's definitely helped me in a lot of ways.
Social work to you means licensed clinical social worker doing therapeutic interventions with folks, micro
Yes,
level work.
yes. And a lot of people that are in my work life get a little surprised when I say that because actually, in my role in government, I'm doing a lot of casework, a lot of resource coordination, and a lot of helping people with SNAP and Medicaid and
Wow.
all that kind of stuff. And people are like, you don't want to keep doing that? And I'm like, no, I love it. I love helping people in that way, but I just don't think that's sustainable for me long term. I'm just really interested in the clinical side.
Good for you for knowing yourself. And the truth is there some people fit in one place and some people fit in another. That
Yeah.
finding the resources, you could probably talk about that for hours. That's a
Well, yeah.
challenging job in the world we live in right now, right?
Yeah, and it was interesting. There was actually a comment you left on one of my projects, and you were like, "Wow, if I ever need help with resources, I'm coming to you." And in my head, I was like, "Good thing, because that's my job. Like, I'm glad I did it well." Um, it is,
Yes. And people, I think it's easier to be the helper than the person being helped. That finding resources for people, as challenging as that is, it's not as challenging as needing those resources. I had
oh, yeah.
someone on the podcast last season that talked about being in a position of needing help, and the
Yeah.
challenge of finding it
Oh,
is
yeah.
rough. Do you feel like you want to go into like working in community mental health or private practice? What direction are you leaning?
I feel really, really open to figuring it out. I would love to work in an IOP. I think that would be great. Social work is such a vast field. I'm trying not to keep myself in a box with it because there's just so many options. How would I know? You know?
Good for you. And I've had students who come to me when they've just graduated with their bachelor's. They want to go on and get their master's, which is fine. You know, everybody has their own trajectory.
Mhm.
But if you live first and you do some volunteer work or you do internships, just what you're saying, you sort of get a feel for, oh, this is a fit and this isn't. And
Yeah.
that's what a wonderful place to be in.
I know it's fun. I like it
It's
here.
exploring. I have done so many different things throughout my long life that that's what I love about social work. It's the reason I'm still teaching it. It's the reason I have a podcast is because we're helpers.
Yeah,
And what a wonderful thing to be in your life.
that's fantastic. I hope that that one day I'm sitting where you are and I'm able to look back at all of it like that. Yeah, I don't know. I have a lot of people say too, they ask if um I'm gonna maybe get my doctorate and, do more personality disorder work. And I'm like, please do not talk to me about more school. I'm in my first semester of my master's. Please do not talk to me
Right.
about more school. Um, but yeah, I don't know. Right now, my thing, I don't think I could ever necessarily work. Don't never say never, but I don't see
Right.
myself working with people with personality disorders because I think it would be really hard for me to eliminate my bias in that. And like, I just got to be honest with myself. I talk about my personality disorder ad nauseum, and I wasn't like that at first. I was like, no one can now. Like, this is the most
Right.
shameful thing in the whole world. I love talking about it now because I'm like, I once felt that way. There are other people who feel that way. Yeah, but
So
yeah, I think I love talking about it really mainly because of the stigma, and I think the stigma, I don't think it comes from a judgmental place normally. I think it just comes from a lack of information because who the hell knows what histrionic personality disorder is? I shouldn't. Like, and when you don't know about it, it might scare you. When you Google the symptoms, like, oh my God, when I start to date somebody and I tell them, they're like, ah, and I'm like, no, it's fine, let me explain. Like, it's scary. And so I just love talking about it. I go back to the being judgmental because I think that there were personality disorders that I was maybe judgmental about before I understood what a personality disorder was. I mean, you see the way that people will talk about, sociopaths. And I'm like,
yes,
and they'll throw around that word. They'll be like, well, that person's a sociopath. And it doesn't, I think to some people it doesn't seem that bad to say that. But if I was walking around in a world where people were saying, oh, that person's a histrionic, I'd be like, well, I guess I suck then.
yes. My theme for this season is curiosity, compassion, and connection.
Love.
And so you're right. We need to connect with more people with compassion and curiosity, saying,
Hmm.
okay, you're different than me. What does that mean in my life? We can just learn so much from one another if we just listen a little bit. I wanted to ask you, do you know the statistics on, like, I think women are the majority of people diagnosed with?
Oh, I have something to say about that.
Okay, go, go.
Um, so yeah, women are diagnosed with it more frequently.
Notice
I
I didn't say they have it more. I said they're
I
diagnosed
caught
with
that one.
it.
I caught
Okay.
that one. Women are diagnosed with it more frequently, and I who knows who has it more? Who knows? Because I think that there's two sides. I think that there is a world where women genuinely do have it more, and I think that that comes from a result of the patriarchal society we live in. There's also the simpler explanation of men just people will say, boys will be boys. When somebody acts histrionic, boys will be boys. When a woman does it, there's a problem.
I feel like if we could just accept people and
Yeah.
say, yeah, that's who you are. We need to come to a place where we can accept everyone, and it's tough because
Yeah.
because sometimes people are hurt by the way you are. And so
Mhm.
just being careful about that. Yeah, that's
Well,
an
and then there's
interesting.
also you have to be able to accept yourself and your own thoughts and behaviors and actions because that's the only reason that really I ended up getting diagnosed. I was able to look at a therapist and it wasn't easy, but I was able to look at a therapist and be like, I act this way. What is going on? Um,
Hmm.
and that was horrible to do. I hated doing that. That still feels so embarrassing to me. Like I still,
Sure.
when I tell my therapist stuff, I'm like, oh my God, like I don't want to say this right now. But and I also think that men in our society like feel so much more uncomfortable doing that than women for so many other reasons.
The
But
way they've been constructed, socially constructed, tells them they can't do those things where they get
Mhm.
in touch with their feelings. Yeah, so true. It just the more that we can try to create understanding,
Mhm.
curiosity, compassion, and connection.
Yeah.
The more, because the more that we're around other people and just listen to their stories, it's one of the reasons that I wanted to do this podcast is because I meet students and then we connect a little bit, but then they're gone. And I
Hmm.
hear people in class, like yourself, that say things that I think are so valuable, and nobody's ever going to hear it but me. And
Yeah.
that's why I thought I'd really like to have a podcast where, I don't know how many there. I don't think there are a lot of people listening to this, but if just one person listens and hears your story today and says, that's how I feel,
Hmm.
that's worth a lot to me. That's social work.
Or 50 years down the line, meet someone that says they have. I mean, it
I
really,
know, yeah,
that's, I think that curiosity and understanding really are the antidote to so many things. And
for sure.
that's why I like to talk about it because I'm like, guys, I'm not scary. I'm not crazy. Like, I'm not. sometimes maybe I'm crazy, but it's not because of my histrionic personality disorder. Like, it's you meet some people, whatever. Um, but I'm not mean, but like I saw some like religious protesters at Pride and like I could not help myself. I could not. Like I'm Catholic. I love God, and I could not. I like screamed at them. I was like, I I literally walked up to them and I go, you don't know shit about Jesus. Like, and I meant to hurt their feelings, and I hope I did. But um in general, like I do try hard not to hurt people's feelings, but if I do, it doesn't really matter that I tried not to. I mean, it matters for our friendship.
I get what you're saying.
It
Yeah.
matters that they're friends with somebody who doesn't try to, but it also matters that when you do accidentally, you say sorry, like God forbid. And yeah,
But
the
some
crazy
people
thing,
will never tell you, right? That you've hurt their feelings. You don't even know. You could say something. I get too caught up in that because you can't
yeah.
just you try to have your best filter and be kind to people and like you're saying, you know, be nice, but sometimes you might screw up and say things you don't mean to. That's where I think the compassion comes in for even someone who says something I don't like.
Yeah, I'm still working on that.
Me too. Me too.
But
Me
I do
too.
try to create like a very safe space with the people who are close to me so that if I do say something that hurts their feelings, that they feel comfortable saying something to me. But I also think I stand 10 toes down on the fact that I think that in high school we should have a class on emotional regulation and interpersonal relationships.
Yes.
Because the stuff that I learned about that at my intensive outpatient program has genuinely changed how I operate in such a good way.
Wow. Yeah,
Like,
I
I
agree with you.
that's so unfair that the only people who get that information are when you're at your absolute lowest and you have the insurance that matches with that place. Like,
Can't even go down that insurance road. We don't have enough time.
no.
But you're right. You're right. And we are so worried about teaching physical activities, so they have PE, and we're worried about making sure everybody gets math and
Hmm.
science and English. But my God, how to balance a checkbook and how to regulate your emotions and deal with the stresses of life seems like to me that would be the best education in the world. Oh,
Histrionic
yeah, please
personality
do.
disorder and the mental health field as a whole. Um, I have yet to know anybody who's a therapist who's like master's level that treats histrionic personality disorder. Um, and I think that that can make sense. You can't know everything, and
Right?
frankly, when are you going to learn about that? But I just want to tell a quick story of how I found the therapist I have now
Oh, you don't need
because
to be quick. It's fine because
um,
I'll make cuts anyway. Go ahead.
my last therapist, she told me, you know, I don't feel comfortable diagnosing you with that, which I so appreciated her doing that. But then obviously when I got the diagnosis, she was like, "Well, I don't know how to treat you for it. I'm so sorry." So I miss her so much. Maybe I'll
Oh,
send this to her. Love her, Miss Kate, every day. But I was like, I need to find somebody that specializes in personality disorders. And I didn't think it would be the easiest thing in the world, but I did not think it would be as hard as it was. So I had searched up, you know, histrionic personality disorder therapist. I was like, they'll probably be in the city, Chicago, Illinois. And I found a lot for borderline personality disorder, which is great. Like everyone deserves their access to their mental health. I love that. But that's it. Like in everything that they specialized in, borderline personality disorder would be the only personality disorder. And I was like, okay, let's go a little broader. Let's search like cluster B because there's different clusters for personality disorders and histrionic personality disorder is cluster B. So is borderline narcissistic. I want to say antisocial, but I can't remember. There was no like cluster B therapist. So I was like, what am I supposed to do? Like, there has to be somebody. There just has to be. There wasn't. I was Googling, there wasn't. And so one day I went to Google Scholar and I searched histrionic personality disorder. And I looked up every single person that has ever contributed to any research regarding histrionic personality disorder, looked up their names, went to see if they were a practicing therapist, and then if they practiced in the state of Illinois. And I found one, which I got lucky because there's really not a lot of research out there, like I said. So I got lucky that out of the few that I found one, and he's great. I tell people, like, he literally wrote the book on treating it. He wrote a
Oh,
book about how
wow.
to treat histrionic personality disorder. So I was like, wow, great, perfect. He's just fantastic. He's a professor too. But I'm like, it took me, God, in total, maybe 5 hours to find a therapist. Then I had to get in contact with him. Let me tell you, that took a long time too to find it because he didn't have like he is practicing, but he didn't have like a practice or like a whatever. Like,
Website.
yeah. So it took forever to get, I literally like paid for LinkedIn Premium to message him and I was like, please treat me. Like, um, so, but I'm like, that took a long time. It took me probably 6 or 7 hours total. It took me paying for LinkedIn Premium to message him. Not everyone has that time. Not everyone has that money. God bless my mom. I'm 24 years old. I'm still under my mom's insurance and she still pays for my doctor's appointments. So I texted her and I was like, I found this therapist. I still have no idea if he takes our insurance. And she's like, well, it doesn't really matter. You have to go to him if that's the only one you can find who can treat you. And I got really lucky that my mom is able to help me with that. But not everyone has that. And I'm like, so not only do very few people know what histrionic personality disorder is, very few also understand it, and very, very few treat it. And then even those who do, there's not a lot of access to them. I'm like, how are we ever going to figure this out if there's all those barriers, which is why I love to talk about it.
What do you think why that is? Is it because there are not a lot of people diagnosed with that? Or is it because of the challenges of treating the disorder? What do you think it is that I'm not expecting you to have a concrete answer, but just what are your thoughts?
I don't know. I think that obviously I'm not working in the mental health field yet. All I really have is Reddit and TikTok, to be completely honest with you, as far as this goes. And a lot of times, licensed social workers will come in and they'll leave their input on it. And to be honest, it seems like there's a lot of stigma, which again, I think just comes from a lack of understanding,
Yep.
a lack of really just like education. But there seems to be a lot of stigma. Not that one mental health issue is harder than the other, but it seems that maybe it's harder to treat. I don't know because there's not, a medication for it. There's medications that help, my depression, which helps that, but there's no
Hmm.
medication for it. I remember I saw one time a therapist say on TikTok that when he's talking to somebody with a personality disorder, it sounds like they're living in a completely different reality. And I've asked several therapists, I'm like, does it sound sometimes like I'm living in a different reality? And they were like, to be honest, yeah, sometimes. And I think that's like hard. And I also don't think that you can expect every therapist or even most therapists to want to treat somebody like that.
Hmm.
And I think that if they don't want to, they absolutely shouldn't. So I don't know. I think that there's probably a lot of things, but overall, I just think that it's the lack of understanding. It's the lack of people talking about it as a society. If you don't know what it is, if you don't find out what it is until grad school, are you really gonna be that interested in treating it? Like, and that's if you do learn about it in grad school. So,
Very interesting. I was just thinking about when you talk about living in a different reality, one of the things that I've always thought is it's hard to know. I mean, I've been married to my husband for 56 years, and I don't always know where he's coming from. So I
mhm,
feel like all of us need to spend more time trying to, not only as therapists, but just as fellow human beings, what is your vantage point like? And that I'm just so glad that you said, "Hey, I have this. I want to talk about this," because I do think it's important so that other people know I'm not alone, first of all, but then
mhm.
also just to understand your vantage point. Do you get to be around other people who, like people who have substance use disorders, go to meetings and get with other people with substance use disorders? Do you, with your histrionic personality disorder, ever run onto other people with the same diagnosis?
I've never met somebody or known of
Oh,
somebody that's had it. That's one of the things that was hard about it too, is that it's a very lonely diagnosis.
yes.
When I got diagnosed with anxiety, I could talk to my friend who got diagnosed with anxiety and stuff like that. But no, I don't know anyone. I know one person personally that has borderline personality disorder. And like I said, they're in the same cluster of personality disorders. They're similar in some ways. And so we're able to like joke with each other. Like that's our relationship. Like one time I was like, wow, you just have the most amount of lore of anyone I've ever met. And they were like, you have the most amount of lore of anyone I have ever met. And we are like, oh, it must be the personality disorders. Like, and so that's really nice for
Yeah.
us for
Yeah.
sure. Um, but God, would I just love to talk to somebody else with HPD. Like I said, Reddit and TikTok are like really good for me. Sometimes if I'm having a hard time, because I feel very comfortable with the diagnosis, but every so often I'm like, what the fuck? So I'll go to TikTok and I'll search histrionic personality disorder every few months and someone will post about it. And I'm like, God, like I'm so seen right now.
Yes.
Um,
When you find that my oldest daughter was diagnosed with trichotillomania when she was in the third grade and she had
mhm,
pulled all of her eyelashes and had gone almost completely bald. I
mhm.
interviewed her on my Mother's Day episode of the
I
podcast.
heard it.
And oh, cool. Anyway, I remember when she was an adult, maybe even in her 30s, I might have that wrong, but when she found a group online called the Tricksters, and they
Mhm,
were other people with trichotillomania, it was like her life turned around. So I know
mhm.
how important it is to have that connection
Yeah,
from people who are compassionate because they know what you're going through. So I'm glad you've at least found one person that's
yeah.
able to understand. Maybe this podcast will open up your world. Maybe
Please,
you'll have a podcast someday about it,
please.
or you'll be the one doing the research and writing the articles. I like
Yeah.
to end every episode with just allowing you to have the last word. And what do you want people to take away from what we've talked about today? Everybody will take away their own, whatever was important to them, but what would you like for them to take away?
I would like just like people to really um really just know consciously because I think a lot of people's what they believe tends to be subconscious. I want people to really consciously know that a personality disorder is a mental health diagnosis, like any other mental health diagnosis. That having a personality disorder doesn't say anything good or bad about the person, and that I think everyone just should just be more curious.
Thank you so much, Caitlin. And thank you for coming and visiting with me today. We'll be in touch, I'm sure, and maybe you'll come back on and share more information with us, and I'll be better informed when you come back. I'm so sorry I didn't do some research. But
No,
anyway,
I don't think
thank you.
I've told you about the ketamine, so
Yeah, I know I'm very interested in that. But anyway,
yeah.
thanks for coming. It's been a joy.
Thank you. I missed your class already. Bye.